Did you know that an estimated 26% of Americans aged 18 and older suffer from a diagnosable mental disorder in a given year? That's 1 in 4, according to Johns Hopkins. And it translates to a lot of people with a serious behavioral health crisis. Hello, this is Tim Connors, and I'm honored to welcome you to a virtual tour of FHN's new Crisis Stabilization Center. This state-of-the-art facility is bringing new hope to area residents facing such troubling scenarios. It will not only help them, it will also be a tremendous resource for family members trying to provide assistance and healing. During our tour, you will meet several FHN staff members who have been instrumental in bringing this important service to our community. You'll learn more about many generous people and organizations that have donated to make this facility a reality. And you'll get a sneak peek at what makes the Crisis Stabilization Center so well equipped to serve so many who so need our help. Let's go inside. As we begin our tour, Mark Gridley, FHN's President and CEO, and Gabe Gonzalez, FHN Assistant Vice President for Behavioral Health, are here to welcome you to the Crisis Stabilization Center.
Greetings and welcome to the Dr. Ravi Amenuvias Crisis Stabilization Unit. Thank you for spending a few minutes to take this virtual tour and celebrate the opening of this wonderful facility. I'd like to take a moment and to thank all of our generous donors and the community members who provided an outpouring of support to make this center a possibility, a reality for the many families that we serve throughout our community. Coordinating a patient's care during a mental health crisis requires a special kind of skill set and environment. And having a place like this that provides a living room type of environment with much greater comfort and ease is much better than having a patient staying for long periods of time in our emergency room, dealing with law enforcement, or other places that are less ideal. I'd also like to thank the contractors who were able to work through the COVID-19 pandemic to be able to open the facility before the end of the year and make it a reality for all of us. Thank you once again for spending a few minutes to do a virtual tour of our new Crisis Stabilization Unit.
Welcome, Tim. Thank you for visiting us today. The staff of the Family Counseling Center and everyone involved with the creation of the Crisis Stabilization Unit welcomes you and the viewers to our center. We are here to serve the community and everyone is welcome.
But Gabe, what does exactly that mean? Can you share a little more with our viewers about when people should think of the Crisis Stabilization Center?
Yes, Tim. So currently across the United States, when someone is experiencing a behavioral health crisis, most often they're going to the emergency department. And that is truly not the best place for their care. They're often a little bit noisier than patients need, and their specialty is managing really true medical emergencies. These crisis stabilization units are beginning to surface in many areas of the nation to begin to address some of those concerns. One of the things that we see is that it is hard to find a psychiatric bed when it's needed. So these centers help improve the continuum of care for patients and ability for families to be involved in the care of the patient. When you look at where the national numbers are looking at, often we see an expected growth within the emergency departments of about 25% over the next 5 years. And all of that growth is behavioral health related.
So the opening of FHN's Crisis Stabilization Center changes all that for the people of Northwest Illinois and Southern Wisconsin?
It does. It provides them a new access point for them to receive care that, number one, is available, but it's also provided by the individuals that specialize in the treatment of behavioral health services. So our nurses, our psychiatrists, our behavioral health technicians will be able to provide the patients with the best care possible. And these patients could come to us with a high level of anxiety, some beginning of depression, some just overall family problems that they just need to be to spend some time with someone that can support them and get them ready to go back into their regular life.
Before we show you the rest of the facility, I'd like to introduce Tonya Thayer, Executive Director of the FHN Foundation. She will tell you more about the thoughtful people whose gifts have brought this center from blueprint to reality.
Thank you very much. As true with so many large-scale projects at FHN, we have many supporters to thank for their generosity and their forethought. It is only with their help that this facility and all these services are offered to each and every one of you. First, we'd like to recognize Dr. and Mrs. Villas, whom this facility is named after. Their significant contribution was pivotal in moving us forward with this endeavor. We are so proud to ask them to share a few thoughts with you today. Dr. Villas, why was this important?
It is important because the mental health is important for well-being, also for thought process and personal relationship. We do not have any centers around here. 1 in 5 adults have mental health issue. In our area, the facilities are far away or not available. So this facility will allow us to treat the patients with respect and dignity.
Thank you. And Mrs. Villas, what are your thoughts?
I fully agreed with my husband's thought process, and our community needs something like this and help them solve their problem at least a little bit.
Thank you very much. Along with the Villases, there are many more generous donors we would like to thank. First McNass Company, State Bank, Community Foundation of Northern Illinois, the Pedersen family, family and friends of Zach Smith, Dan Neal, and the family of Leonard and Mildred Ferguson. As we continue on our tour today, you will get more information about how each of these donations came together to build a solid foundation for this wonderful and very much needed community asset.
Here we are in the Zach Smith welcome area, where patient needs are first assessed. To talk with us about how important it is to have a facility in our community, we will get some perspective from FHN's Director of Emergency Services, Tonya Pennington. Tonya, from your vantage point, why is the Crisis Stabilization Center a better match than the traditional emergency room for a patient with a behavioral health problem?
Sure. In the most recent years, the emergency department has witnessed an increase of patients experiencing such crisis as a behavioral health crisis. Studies have shown that the emergent and critical nature of an emergency department is not an ideal setting for someone experiencing such crisis. Here, at the Crisis Stabilization Center, they will be able to wait in a living room type environment while waiting for evaluation and treatment. We see this as a win-win because the patient is able to be treated and evaluated in a home-like environment, which is much more successful.
I'm here with Freeport Police Chief Matt Summers. Matt, how does the Crisis Stabilization Center align with your law enforcement practices?
I agree with Tonya. I think the new center will help us in circumstances where people are in personal crisis. We're trained to serve and protect. However, these professionals are experts in crisis care for behavioral health.
Our next tour stop is the First McNass Nurses Station. FHN psychiatric nurse Samantha Gary will tell us about how skilled nurses and counselors will use this space. Hi, Samantha.
Hi, Tim. We'll walk you through our nurses station here. First, we'll show you over here. We have a two-way video system that allows us to communicate with people who are outside the door. That offers us a chance to see people, assess them, assess their needs, as well as keep the patients and the employees safe in this space. We also have our computer stations that are all set up. Therapists, our nursing staff, our doctors, they can all use these to access patients' medical records, place orders, look through patients' charts, and so forth. You can see the height of the nurses station. It's a little higher than normal. That provides any staff who are on this side of the nurses station safety if any patients were to decide to escalate. Also, it allows for us to be HIPAA compliant. People can't be peeking over the nurses station and seeing what's in there. But it also allows for us to be able to monitor what's still out in the room, what's going on, as well as keep that communication open between patients, which is very important in what we're doing here.
As we move on to the medication room, sponsored by the Community Foundation of Northern Illinois, we have CIFNO President Dan Ross, here to tell us more about the grant to help fund this facility.
Thank you, Tim, and it is an absolute pleasure to be standing here in this beautiful facility. The grant that FHN received is part of the Community Foundation's annual Community Grants Program, and these grants are reviewed and ultimately selected by committees of volunteers made up from within the communities that they actually serve. Our reviewers are looking for projects that, among other things, enhance the overall quality of and access to healthcare within our region. And also looking for projects that play a role in the overall community well-being. And I can't think of a better project than this one that meets all of those criteria. It is deeply rewarding to know that when a member of our community is experiencing a mental health crisis, there is a place like this that they can come to that is safe and welcoming, and they'll get the emergency care that they need. Congratulations to FHN, and thank you for letting us be a part of this.
We're back with Samantha again, and she's now going to tell us the significance of the medication room.
Thanks, Tim. So the medication room here is crucial to our success. It's going to house many of our prescription as well as over-the-counter medications that we're going to provide to patients. It'll be quickly accessible to us as well as locked down from a patient safety standpoint. So only authorized people will be allowed to come in here through badge access. So in here we have supplies to meet our basic medical needs of patients, whether they come in with wounds or basic medical medications to manage blood pressure, diabetes, stuff like that. That will all come from a Pyxis, which will be housed here. The Pyxis is a medication supply. It is managed by our pharmacy, so it'll have the patients built into the system. We'll be able to identify them over name, date of birth. The medication will be dispensed. We only have access to certain medications when we're in there. All right, so this is the patient medication window. The process will be patients will come to this window at designated times throughout the day to receive their scheduled medications as well as any medications they may need throughout the day. We call those PRN medications. And then as far as patient safety and staff safety, we are able to pull down this safety shield that also locks when the medication room is not in use, when there's nobody in here, or if a patient safety concern were to arise out in the milieu room.
As you can see, this center has been designed with patient needs at the forefront. The Pedersen Family Security Station is another important area, both for patients and staff. Dr. Rebecca Pedersen is here with us today to provide some insight into this important function. Dr. Pedersen, please tell us more about why you wanted to sponsor this station.
My family and I wanted to sponsor this security station and support the Crisis Stabilization Center because we know that security is an integral part of making this center work well. When patients are here, they might be scared, disoriented, even angry, and that brings out social behaviors that aren't acceptable. And so by having a security presence in our center, we can make sure that our staff and ultimately our patients are protected. Safety is one of our priorities here.
Working security in healthcare for the past 30 years and assisting in the emergency department, where the rules are necessarily rigid, I feel that the Crisis Stabilization Center offers an environment for healing and is better equipped to de-escalate and treat the behavioral health patient.
Thank you, Dr. Pedersen, and your family for the contribution that made this possible. I wanted to talk a little bit more about how security is different in this environment. Many of the patients that we take care of come with bad experiences with individuals that wear a uniform. And so what we often do is that we use security a little bit different than most other institutions do. Our safety is used through training our staff in appropriate de-escalation techniques and ensuring that they are avoiding getting into any form of confrontations with patients. And security really becomes an addition to the team for those instances when patients are really out of control. patients are often more willing to work, especially in an environment like ours where they're voluntary for care and where they feel more comfortable because of the environment it is.
Now that we've discussed security, let's shift to something a little lighter, but also important. Food. We'll make a quick pit stop in the Dan Neal Nutrition Center. Dan, can you tell us why you chose to give to the facility?
Well, Tim, I've been looking forward to something like this for at least 30, 40 years. Emergency rooms are really not the best place to take a person who's in mental health crisis. Emergency rooms are the grand central stations of the healthcare system. And you know what that means. A lot of chaos, a lot of activity, high stress, sometimes long times waiting, especially if you're that mentally ill patient. So this is going to be a much less stressful place for a person to come to. You wouldn't take a person having a panic attack to Grand Central Station. And, you know, emergency rooms are really stressful places. And so this is going to be much better in terms of comfort, in terms of stress-free, and the food part of it I like especially because people need a break in the process of dealing with a mental health crisis. Both the patient and the person who's providing treatment. This will give them a place to go to get some nourishment, to decompress, to just reduce the stress of the whole situation. So I'm really happy with this whole process, this whole unit, and wanted to give as much support as I could.
Now we are here with FCC Clinical Director Susan Johnson. It's important to have healthy food at a facility like this. Susan, can you tell us more about why this matters?
So often when people have mental health crises, they don't take care of themselves. They isolate themselves, they don't eat well, they don't hydrate well, and that contributes to their downward spiral. So here in this safe environment, they can get healthy food and drinks and have the opportunity to fortify themselves for their journey ahead.
Patients will come to the center with a variety of issues that they might want to address when they're here. That is the essence of the State Bank Group Room. Chris Schneiderman from State Bank is here to talk about their involvement. Chris?
Thanks, Tim. We're very excited to support the group room and sponsor it. Our community involvement means a lot to State Bank. Community involvement is part of our mission statement, and we're always honored and privileged to be able to support any local endeavor. We find it especially exciting to support the group room here because we know it's going to support some very confidential and some very problem-solving discussions with the patients here, and that's a lot of what State Bank does too. We are very highly respected for our confidentiality, especially dealing with business customers, and we know what it's like to problem solve every day, especially in the pandemic. So again, we're really excited to support any local endeavors like this, especially for FHN, which we know is so important to our local community.
I'm here with Susan Johnson again, and she's going to tell us why the State Bank Group Room is so important to this center.
This is an important room in terms of people's recovery from their crisis. A lot of personal work will be done here. Groups will be held, they'll be facilitated by trained clinicians, and there'll even be a pet therapy group where people will be able to meet with trained pets to help them become calmer and help facilitate their recovery.
Our final spot of the tour is the Leonard and Mildred Ferguson living room area. Gabe, could you tell us more about this space?
Of course, Tim. This is, the living room area is actually the central for our crisis stabilization unit. This is where patients are going to spend a large portion of their time. As you see, there is 8 stations where patients can really gonna leave. This is where they're going to be able to sleep at night, and through the day, this is a place where they can find some solace when they need to be away from other people. It is an important part of the care development or the care, the services services that we provide. It's wide open so that if a patient needs to pace, they can do that without feeling restricted. It is wide open to encourage interaction between the patients so that when they are leaving this environment, not only do they get all the clinical services from our staff members, but they begin to create a support system that can help them outside of the clinic. As you can see around here, there'll be some other areas that you have visited, and those areas are very important for the clinical services, but this living room area is where everything happens. And it is a beautiful space to give the patients the ability to really feel comfortable and feel like they're at home.
This facility is clearly designed to help people better cope with mental health emergencies. Is there anything else you'd like the people to know?
Well, as exciting as this new center is, it's also a very worthwhile investment. So not only are we able to provide personalized and comprehensive care, which is better during a psychiatric emergency or during substance abuse, it leads to better outcomes when you have this kind of environment, but it's also much more cost effective than if somebody was going to the emergency room. A study that was done in 2017 in rural Illinois was able to demonstrate that there was a lower length of stay when stabilization centers were put in place, and there was also a significant cost savings. The study actually reflected that over $4 million in Medicaid costs were reduced. So that's a significant amount of cost reduction. So not only is this a win as far as care for the patient, but it's also a win on cost. So a win-win for all of us.
On behalf of the FHN Foundation Board of Trustees, I'd also like to thank our donors again for their investment. They can take pride in knowing they made a difference for patients experiencing a behavioral health crisis. Their dedication to helping friends and neighbors in need is a wonderful example of our community's generosity.
Folks, there you have it. A look at another way that FHN is working to keep your family happy, healthy, and safe. If you or a family member have a mental health emergency, there is now a new resource to help them navigate a very difficult situation. We hope you have enjoyed your tour of the Dr. Ravi and Mrs. Manu Vias Crisis Stabilization Center at FHN Family Counseling Center. If you have questions, please call 815-599-7300. Now, more than ever, FHN is here for you.